On the right side, it is the right side, it is the left side. Brachiocephalic trunk arises and left carotid and left subclavian artery. So it is the arch of aorta which gives the right brachiocephalic trunk, left common carotid artery, left subclavian artery, and this brachiocephalic trunk so it is the brachiocephalic trunk. This is the left common carotid artery, left subclavian artery. Brachiocephalic trunk on the other hand. This is the left subclavian artery. From the subclavian artery arises the vertebral artery. Vertebral artery enters the foramen transversorium of the 6 cervical vertebra, and in this way it goes up. So vertebral artery arises from the subclavian artery, then it enters the foramen transversorium, the foramen present in the 6 cervical vertebra, then proceeds onwards to the foramen transversorium of the 5th, 4th, 3rd, 2nd and 1. And from the first cervical vertebra or the atlas, it curves medially and enters through the foramen magnum in the lower part of the medulla oblongata. So it goes up to the foramen transversorium, through the foramen magnum, where at the lower border of the foramen magnum is situated, where the lower border of the medulla oblongata. So it enters the lower border of the medulla oblongata and proceeds up anterior to the medulla oblongata, and just at the lower border of the pons. Now I am drawing the pons here. This is the midbrain, then the pons, and this is the medulla oblongata. So vertebral artery goes in front of the medulla oblongata, one on either side, right and left, and the lower border, this is the pons. At the lower border of the pons, 2 vertebral arteries join together and form a single basilar artery. So 2 vertebral artery in the lower border of the pons. It is the pons, it is the midbrain pons medulla. At the lower border of the pons, it joins to form a single artery which runs on the midline of on the anterior aspect of the pons, and these artery we call the basilar artery. And as it enters, it goes up, and at the interpedunculaar fossa, this basilar artery divides into 2 posterior cerebral artery. So this is the normal. So vertebral artery is a branch of the subclavian artery. It goes up, enters the cranial cavity through the foramen magnum, then proceeds there are 2 vertebral artery, then proceeds anterior to the medulla oblongata at the lower border of the pons, it joins together to form the basilar artery, which at the interpetuncular fossa, that means just above the midbrain, it divides into two posterior cerebral artery. Then what's happened to the carotid artery? Carotid artery proceeds here in the carotid triangle within the carotid sheath and enters. There is an opening in the lower surface of the petrous part of the temporal bone known as the carotid opening, and through this carotid opening, or it is called the carotid canal, it enters the petrous part of the temporal bone. Then it makes a right angle bend within the petrous part of the temporal bone. So initially it goes up, then make a right angle bend and proceeds anteriorly. So internal carotid artery, this is the temporal. This is the petrous part of the temporal bone and the lower border, and this is the apex of the petrous part of the temporal bone, and here lies the foramen lacerum. At the apex of the temporal bone, there is an foramen which is usually closed by a cartilage, and this foramen we call the foramen lacerum. So the carotid artery, this carotid artery proceeds anterior carotid triangle, enters the carotid canal and make a right angle bone and proceeds anteriorly, and through an opening it comes out from the petrous part of the temporal bone and courses over the foramen lacerum, and here it enters a venous sinus. There is a venous sinus, and here is it is the petrous part of the temporal bone, and it is the sphenoid bone. And in the sphenoid bone, there all that there is a venous sinus, one on either side, which we call the cavernous sinus. So it enters the cavernous sinus, and there is blood in the cavernous sinus. Cavernous sinus is a venous blood, only separated from the blood by the endothelial lining of this carotid artery. So it simply floats in the blood of the cavernous sinus, accompanied by other nerves. Already you know, oculomotor nerve, trochlear nerve, abductor nerve, etc. So there are also nerves is also there. It is accompanied within the cavernous sinus. There are nerves is also there, and in the cavernous sinus, it proceeds and comes out, piercing the roof of the cavernous sinus. So it enters the cavernous sinus, piercing the roof, again comes out, piercing the roof of the cavernous sinus. Here it rises, one on either side of the, close to the optic chiasma. And here it divides, it again makes a bend. It makes a bend and divides it into two terminal branches known as the anterior cerebral artery and middle cerebral artery. Anterior cerebral artery and middle cerebral artery. So, আমরা যদি এখানে আঁকি, one on either side, coming out from the cavernous sinus, a cut section of the carotid artery, and just anteriorly it divides into carotid artery this internal artery gives to anterior cerebral artery, and another largest branch is give, it is the middle cerebral artery. So it is the internal carotid artery. Internal carotid artery gives two terminal branches, final branch, anterior cerebral artery and middle cerebral artery, and it is the posterior cerebral artery. It is a branch of the basilar artery. So anterior cerebral artery is a branch of the internal carotid artery. Middle cerebral artery is a branch of the internal carotid artery, and posterior cerebral artery is a branch of the basilar artery. Internal carotid artery not only gives its terminal branches, anterior and middle cerebral artery, it also gives other branches in this close vicinity. First, it gives an ophthalmic artery. It gives an ophthalmic artery. It gives an ophthalmic artery which enters through the optic canal into the orbit to supply the structures within the orbit. It also gives an anterior choroidal artery. What is choroidal artery? I will just come on. It gives an anterior choroidal artery. It pierces the brain and supplies the ventricles and other deep structures. Key artery. So, anterior choroidal artery is a branch of the internal carotid artery. Last but not the least, it gives a branch known as the posterior communicating artery. 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 It communicates or joins with the posterior cerebral artery, and two anterior cerebral artery also join together as the anterior communicating artery. So, it completes a circle known as the arterial circle of Willis, hexagonal in shape, boundary anteriorly anterior communicating artery between the two anterior cerebral artery, anterolaterally by the anterior cerebral artery, laterally by the carotid artery, posterolaterally by the posterior communicating artery, and by the basilar artery, dividing into two posterior cerebral artery. This is the arterial circle of Willis. This arterial circle of Willis makes a communication with internal carotid artery and vertebral artery, and make a communication with the right side blood supply of the brain with the left side. But still, you know, brain is a very highly vascular structure and requires oxygen. Brain weight is only 2% of our body weight, but it receives 20% of the cardiac output. Only 2% of our body weight is the brain, but it needs 20% of the cardiac output, and oxygen capacity is very high. But you will know what is the function of this arterial circle of Willis. Actually, normally it's just simply a communication, no other else, because the only thing is that the pressure of all blood pressure here, all are equal. All are equal. Normally, there is no blood flow from right to left or left to right. Supply the right side of the brain. Right middle cerebral artery will supply the right side of the brain. Left middle cerebral artery will supply the left side of the brain. There is no normal in physiological condition. There is no crisscrossing of the blood. Then what is the need? Need is that in our every day-to-day activity, there may be certain rise of blood pressure, small artery. Then these come into action. If there is a block, the blood will flow in this way and supply from right to left. So if there is a rise in blood pressure in the right side of the brain, the blood will shift to the left, so that blood pressure will be equal on two sides. So normally there is no crisscrossing of the blood from right to left, left to right. Only it acts when there is an abnormality, rise of blood pressure, blockage of artery, then this arterial circle of Willis comes into action. So this is the main function of the arterial circle of Willis. Now, so anterior cerebral artery, middle cerebral artery and posterior cerebral artery, plus we have to know certain other branches of the vertebral artery and the basilar artery. The vertebral artery not only gives joint, it also gives anterior spinal artery. Two anterior spinal artery arises from the two vertebral arteries, right and left, and they join in the midline and make a single trunk and proceeds to the anterior median fissure of the spinal cord. So anterior spinal artery, so it is called as, though it arises from the vertebral artery, it arises from the lower in front of the medulla oblongata, and two anterior spinal artery join together to form the midline anterior spinal artery single trunk and goes along the midline to supply whole of the spinal cord. It also gives some medullary branches to supply the medulla oblongata, multiple medullary branches. It also gives meningeal branches to supply the meninges, dura mater arachnoid of the posterior cranial fossa. And last but not the least, it gives a very important branch known as the posterior inferior cerebellar artery. Posterior inferior cerebellar artery to supply curves round the lower part of the medulla oblongata and goes to the cerebellum to supply the cerebellum and also lateral part of the medulla oblongata. So if it is a block, there is a chance some cerebellum plus medulla oblongata will be hampered. Next, it gives a branch from the posterior cerebral artery to posterior spinal artery. Sometimes posterior spinal artery may arise from the vertebral artery also. So in some books written, vertebral artery has got posterior spinal artery as its branch. But normally, maximum percentage of cases, posterior spinal artery arises from the posterior inferior cerebral artery. Whatever it may be, both are correct. If you write the posterior inferior cerebral artery arises from the vertebral artery, correct. And two posterior spinal artery, it lower part, it divides into two, lateral and medial, and proceeds downwards to the posterior part of the spinal cord. So these are branches of the vertebral artery, of which the most important here is the posterior inferior cerebellar artery, which supplies the lower part of the lateral part of the medulla oblongata as well as the cerebellum. Next, basilar artery. Basilar artery, most important branch is the posterior cerebellar artery, terminal branch. Just below the proximal to the posterior cerebral artery, superior cerebellar artery, superior cerebellar artery, more or less like going parallel with the posterior cerebral artery. Another important thing is that between the posterior cerebral artery and the superior cerebral artery, one nerve lie in between. It is the posterior cerebral artery, it is the superior cerebellar artery, oculomotor nerve, sometimes trochlear nerve lies in between. So, if there is an aneurysm, what do you mean by the term aneurysm? Means dilatation of the artery. Dilatation, swelling of the artery. If arterial wall is very thin, gets very thin due to disease or congenital disease by birth, artery wall gets thin, and due to pressure, the artery wall bulges out, causing swelling of the artery, and there is a chance of rupture. So huge bleeding, which is called the aneurysm of the artery. So if there is an aneurysm of the posterior cerebral artery, it may compress the oculomotor nerve, causing lateral squint and other factors, right? Dilated pupil, etc. Next, what are the other branches? So posterior cerebral artery, superior cerebral artery, and the branches is the multiple pontine branches. এইখানে medullary branches দিয়েছিল বেশি vertebral artery, এ দিয়েছে multiple pontine branches. লাস্ট এইখানে আরেকটা কালকে বলেছিলাম আর্টারিটা, ও অ্যান্সার করেছিল, ওখানে বসেছে internal acoustic artery by internal auditory artery, which enters through the internal auditory, যেখান থেকে facial nerve, internal auditory meatus, যেখান দিয়ে facial nerve, vestibulocochlear nerve ঢোকে, internal auditory meatus act. There is in the petrous part of the temporal bone. Three structures usually enters through this opening. One is the facial nerve, another is the vestibulocochlear nerve, and another this artery, the internal auditory artery by labyrinthine artery. Another name of internal auditory artery is the labyrinthine artery. So it is the branches of the basilar artery. And last arises is the antero-inferior cerebellar artery. Antero-inferior cerebellar artery. Antero-inferior cerebellar artery. So these are the branches of the vertebral and basilar artery. গেল। নেক্সট আমাদের জানতে হবে যে আর্টেরিয়াল সার্কেল অফ উইলিসের ব্রাঞ্চেস কি, দ্যাটস ইম্পর্টেন্ট। আর্টেরিয়াল সার্কেল অফ উইলিসের ব্রাঞ্চেস হচ্ছে ইউজুয়ালি 3 টাইপস। কিরম ভাবে ব্রাঞ্চেস দেয়? আমি আর্টেরিয়াল সার্কেল অফ উইলিস কথাটার মানে কি কোনো পার্টিকুলার আর্টারি বলছি না, কারণ arterial circle of Willis is made up of so numbered of arteries: anterior cerebral artery, middle cerebral artery, posterior cerebral artery. They give more or less branches in 3 patterns. What are the patterns? Key pattern. First, long branches are given, which we call cortical branches. কারো নাম নেই। cortical branches আমরা কিভাবে তাহলে নাম দেব? cortical branches of anterior cerebral artery, cortical branches of middle cerebral artery, cortical branches of posterior cerebral artery. posterior communicating artery gives, কিন্তু আমরা ওগুলি আর বলছি না, মেইন আর্টারি গুলি বলছি। cortical branches মানে এটা কি? cortical branches will supply the superficial part of the brain. The superficial part of the brain. Area 4, area 6, precentral gyrus, postcentral gyrus, paracentral lobule, medial frontal gyrus. এই superficial part, superior temporal gyrus, এগুলিকে সাপ্লাই করে। বুঝতে পেরেছো? superficial part. আমরা জানি ব্রেনের মধ্যে ক্যাপসুল এগুলি রয়েছে ডিপে, ভেতরে, বাইরে থেকে we cannot see this structure. So cortical branches is supplied by this from the anterior side, anterior part of the brain, supplied by the cortical branches of cortical branches of the anterior cerebral artery. The lateral sulcus region, Broca's area, our motor speech area, is supplied by the cortical branches of the middle cerebral artery. Visual area supplied by the posterior cerebral artery as well as middle cerebral artery. ছেড়ে দাও। তাহলে এইগুলি গেল কর্টিক্যাল ব্রাঞ্চেস। এটাকে কি বলি আমরা? কর্টিক্যাল ব্রাঞ্চেস। নেক্সট টাইপ অফ ব্রাঞ্চেস, বেটার টু সে টাইপ অফ ব্রাঞ্চেস, cortical type of branch. Next is the central or striate type of branch. Striate artery, that is very important. These are the deep arteries which goes deeper the brain and supply the deeper structures, thalamus, basal ganglia, internal capsule. তাকে আমরা বলি striate arteries। কি বলি? striate arteries। তাহলে যদি lateral striate artery damage হয়, the internal capsule may be damaged, thalamus may be damaged, so on and so forth। আর cortical artery যদি ড্যামেজ হয়, superficial part of the cortex, Broca's area will be damaged। Next, last but not the least, the choroidal branches। The choroidal branches which supply mainly the ventricle and which produce, they from their capillaries produce the choroid plexus, and by which choroid plexus forms the CSF. So it supplies the ventricle. We call the choroidal artery. I have already told you this is the anterior choroidal artery, and posterior choroidal artery arises from the posterior cerebral artery. So anterior choroidal artery arises from the internal carotid artery, and posterior choroidal artery arises from the posterior cerebral artery। তাহলে এই গেল আমাদের আইডিয়া অ্যাবাউট দ্য ইন্টারনাল ক্যাপসুল। ইন্টারনাল ক্যাপসুলের ব্রাঞ্চ ফাংশন কি, ব্রাঞ্চ কি, কর্টিক্যাল ব্রাঞ্চেস, টাইপ অফ ব্রাঞ্চেস, কর্টিক্যাল টাইপ অফ ব্রাঞ্চ, স্ট্রায়েট টাইপ অফ ব্রাঞ্চ অ্যান্ড কোরোডিয়াল টাইপ অফ ব্রাঞ্চ। এরপরে আমরা আসছি যেটা পরীক্ষায় একবার দিয়েছিল, সে হচ্ছে পাল্টে হয়ে গেছে, পাল্টে তাহলে আর সময় নেই। আচ্ছা, হ্যাঁ, আগেরটা দিয়েছি। আগেই বলেছি কর্টিক্যাল ব্রাঞ্চেস সাপ্লাই দ্য সুপারফিশিয়াল পার্ট অফ দ্য ব্রেন। তাহলে কি কি আর্টারি রয়েছে? অ্যান্টিরিয়র সেরিব্রাল আর্টারি, মিডল সেরিব্রাল আর্টারি অ্যান্ড পস্টেরিয়র সেরিব্রাল আর্টারি। এবার কোনটা কত জায়গা? We know in the cerebrum there is a lobe, there is a pole, frontal lobe, parietal lobe, occipital lobe, temporal lobe, frontal pole, temporal pole and occipital pole। তাহলে এটা যদি সেরিব্রাম হয়, এটা প্যারাইটো অক্সিপিটাল সালকাস, এটা হচ্ছে তোমার প্রি অক্সিপিটাল নচ। তাহলে এটা হচ্ছে অক্সিপিটাল লোব। এখান থেকে যদি টানি, এটা হচ্ছে সেন্ট্রাল সালকাস, তাহলে এটা হচ্ছে প্যারাইটাল লোব, এটা হচ্ছে ফ্রন্টাল লোব, আর এটা হচ্ছে টেম্পোরাল লোব। আমরা তাই তো জানি, হ্যাঁ? বাস, এবার কিভাবে ডেসক্রাইব করব? দ্য সেরিব্রাম of the brain is supplied by three main arteries: anterior cerebral artery, middle cerebral artery and posterior cerebral artery। Next para, the territory supplied by the anterior cerebral artery, territory supplied by the middle, এরম ভাবে। So territory supplied by the anterior cerebral artery, anterior cerebral artery টেরিটরি। তারপরে এবার একটা বড় হাতের এ লিখলাম, ক্যাপিটাল এ। সাপ্লাইড বাই দা, ছোট্ট করে লিখলে লিখতেও কম হবে, সাপ্লাইড বাই anterior cerebral artery। এর in superolateral surface, of cerebrum. Anterior cerebral artery is supplied about one finger. Anterior supply artery is supplied number one. A strip of cortex, a strip, তারপর B লিখবে, on the superolateral surface of the frontal lobe parallel to the superomedial margin. শুধু এইটুকুনি জায়গা, জাস্ট ওয়ান ফিঙ্গার ব্রেথ, এই ওপরের জায়গাটুকুনি সাপ্লাই করে আপ টু সেন্ট্রাল সালকাস. It is supplied by the anterior cerebral artery. অনেকে বলে প্যারাইটো-অক্সিপিটাল সালকাস অবধি, আপ টু প্যারাইটো-অক্সিপিটাল সালকাস অবধি সাপ্লাই করে অ্যান্টিরিয়র সেরিব্রাল আর্টারি, আপ টু প্যারাইটো-অক্সিপিটাল সালকাস অবধি সাপ্লাই করে অ্যান্টিরিয়র সেরিব্রাল আর্টারি. এটা দেখা গেল সুপিরিয়র সারফেস. এরপরে তো মিডিয়াল সারফেস আছে, ইনফিরিয়র সারফেস আছে ব্রেনের, তাহলে সেটাও দেখি, পাল্টে দিই. Actually, anterior cerebral artery mainly supplied the medial surface of the brain. Medial surface of the brain. Anterior cerebral artery, after its origin, courses along anterior cerebral artery courses. So it is supplied the medial frontal gyrus, cingulate gyrus, paracentral lobule, and part of the up to the precuneus. So whole of the medial surface of the frontal lobe and parietal lobe is supplied by the anterior cerebral artery. কিন্তু superior surface only strip. অ্যাকচুয়ালি কি ব্যাপার, মিডিয়াল সারফেসকে সাপ্লাই করে একটুখানি বাইরের সারফেসকে করছে. তাহলে এই পিকচারটা ইজ ভেরি ইম্পর্টেন্ট. কত অবধি যাচ্ছে, এটাকে কি সালকাস বলা হয়, প্যারাইটো-অক্সিপিটাল সালকাস. এইখানে কোথা থেকে, ফ্রন্টাল পোল থেকে স্টার্ট করে ওয়ান ফিঙ্গার প্যারাইটো-অক্সিপিটাল সালকাস, আর এখানে হোল অফ দ্য মিডিয়া সারফেস অফ দ্য ফ্রন্টাল এই frontal lobe and parietal lobe above the corpus callosum is supplied by the blue color. This is the blue color by the anterior cerebral artery. Inferior surface কি হয়, এখানে বোধহয় ছবি নেই. Inferior surface একটু আঁকি. Only the orbital surface, a strip of cortex in the surface of the orbital surface is supplied by the anterior cerebral artery. তাহলে এরকম ভাবে লিখতে হবে, in medial surface whole of the frontal lobe and parietal lobe up to the parieto-occipital sulcus, containing the medial frontal gyrus, paracentral lobule, cingulate gyrus, and precuneus. Number 3, in inferior surface, the medial half of the orbital surface of the frontal lobe of the cerebral hemisphere. Finish. তাহলে এইরকম ভাবে প্রত্যেকটা আর্টারিতে তিনটে ভাগে দেখতে হবে, একটা সুপিরিয়র ল্যাটারাল সারফেসে, একটা মিডিয়াল সারফেসে, একটা ইনফিরিয়র সারফেসে। আমরা কি করি পরীক্ষায়? শুধু সুপিরিয়র ল্যাটারাল সারফেসটা লিখে চলে যাই, ভাবছি ওটাই মেন, বাদ দিয়ে দিলাম মিডিয়াল সারফেসটা, এত বড় সারফেসটা বাদ দিয়ে দিই। অথবা কেউ আরেকটু ভালো, তারা they write the superior lateral and the medial surface of the brain but forget to write the inferior surface। তার জন্যই বললাম প্রত্যেকটা আর্টারি টেরিটরি একটা ল্যাটারাল সারফেস, মিডিয়াল সারফেস অ্যান্ড ইনফিরিয়র সারফেস অফ দ্য ব্রেনকে লিখতে হবে, বাকিটা খুব ইজি। এরপরে হচ্ছে মিডিল সেরিব্রাল আর্টারি। বুঝতে পেরেছো এটা কতটা সাপ্লাই করে? তার মানে কি হচ্ছে, তোমার প্যারাসেন্ট্রাল লোবিউল যদি ড্যামেজ হয় এই দিকটায়, তাহলে ইট মে ড্যামেজ দ্য আওয়ার ভলেন্টারি কন্ট্রোল অফ ডিফিকেশন অ্যান্ড মিকচুরেশন। সুতরাং মিডিল অ্যান্টেরিয়র সেরিব্রাল আর্টারি যদি কোনো কারণে অবস্ট্রাকশন হয়, দেয়ার ইজ অ্যান ডিফিকাল্টি, অর অটোনোমাস ব্লাডার অর অটোমেটিক ব্লাডার হয়ে যাবে, ইউরিনারি ব্লাডার। তাহলে এই পিকচারটা সবাই মুখস্থ করবে। নেক্সট, মিডিল সেরিব্রাল আর্টারি। ইন দ্য সুপিরিয়র ল্যাটারাল সারফেস, main arterial supply of the superior lateral or lateral surface of the cerebrum is the middle cerebral artery. The superlateral surface of the frontal and parietal lobe, except a strip of cortex supplied by the anterior cerebral artery, is supplied by the middle cerebral artery. Plus, it supplies the, এটা পরীক্ষায় জিজ্ঞেস করে খুব, মানে ওরালে, ফ্রন্টাল পোল কে সাপ্লাই করে? স্যার, অ্যান্টিরিয়র সেরিব্রাল আর্টারি। টেম্পোরাল পোল কে সাপ্লাই করে? মিডল সেরিব্রাল আর্টারি। তাহলে হোল অফ দ্য অন দ্য, তাহলে মিডল সেরিব্রাল আর্টারি অন দ্য সুপিরিয়র ল্যাটারাল or lateral surface, whole frontal and parietal lobe except a strip of cortex in the upper part, and also whole of the superior lateral surface of the temporal lobe except a strip of cortex by inferior temporal gyrus is supplied by the middle cerebral artery. And so, most important, Broca's area, sensory speech area, all are under control or supply of middle cerebral artery. সুতরাং middle cerebral artery block হলে aphasia হবে, motor aphasia. Patient can produce sound, কিন্তু cannot produce proper sound, কারণ আর্টিকুলেশন হবে না, বিকজ এইখানটাই সাপ্লাই করছে ল্যারেঞ্জিয়াল মাসেলস, প্যালেটাল মাসেলস, এগুলিকে সাপ্লাই যাচ্ছে। সুতরাং দে ক্যানট প্রপারলি আর্টিকুলেট। সুতরাং আমি উচ্চারণ, আই ওয়ান্ট টু প্রনাউন্সিয়েশন ক্লক, আই মে প্রনাউন্সিয়েশন ক্র্যাক। সো দিস ইজ নোন অ্যাজ দ্য মোটর অ্যাফাসিয়া। সো Broca's area is under control of middle cerebral artery for MCQ. Broca's area is supplied by which cerebral artery? Anterior cerebral artery, posterior cerebral artery, middle cerebral artery, posterior communicating artery, vertebral artery. Right dite hobe middle cerebral artery. Next, medial surface e khub kom, middle cerebral artery medial surface e only is anterior part of the temporal lobe. Next হচ্ছে posterior cerebral artery. Posterior cerebral artery supplied the whole of the gyrus. ও আর এইখানেও তাই, this is like the cerebral artery in the orbital surface. Our posterior cerebral artery is supplied by the occipital pole and the inferior temporal gyrus, and this part inferior temporal gyrus in the orbital surface, in the inferior surface. But here is another important question comes: what is macular sparing? What is macular sparing? অনেকবার দিয়েছি, কি ব্যাপারটা কি? অক্সিপিটাল এইখানটাই রয়েছে আমাদের ভিজুয়াল এরিয়া, সবচেয়ে হায়ার সেন্টার অফ ভিজুয়াল সেন্সরি এরিয়া is situated in the occipital lobe, not pole, and in the occipital pole ঠিক এইখানটায় এই জায়গাটা এক্সট্রিম অক্সিপিটাল পোল, এইখানটা represents the macular area, macula lutea. আমি বলেছিলাম macula lutea is the area where maximum number of cones are present, giving more acuity of vision, color vision, etc. So macular area, the most acuity of vision, একদম স্পেসিফিক দেখতে পাচ্ছি সেকেন্ডের কাটাটাও বা সেকেন্ডের বারগুলি দেখতে পাচ্ছি, it is due to macular action. We call the acuity of vision. Convergence হচ্ছে, pupil constrict হচ্ছে এবং লাইট রেটা গিয়ে ম্যাকুলাতে পড়ছে, রেটিনার ম্যাকুলা তোমরা জানো 3 মিলিমিটার নেজাল টু দ্য অপটিক পোল, সেইখানটায় গিয়ে পড়ছে, আমরা অ্যাকিউটি অফ ভিশন হচ্ছে। সো ইট ইজ দ্য, আমাদের যেমন থাম হচ্ছে মাস্টার ফিঙ্গার, থাম ছাড়া আমরা অচল, একটা ফিঙ্গার চলে গেলে কি we can easily spare this finger or this finger, but we cannot spare thumb. Similarly, macula is the master area of the retina, and so damage, if posterior cerebral artery is damaged, the visual area is damaged, including the macular area, but never happens this time. দেখা গেছে posterior cerebral artery block হলো, there is a block of posterior cerebral artery, ভিজুয়াল সেন্সেশন গেল, কিন্তু ম্যাকুলা আমরা কাছ থেকে অ্যাকিউটি অফ ভিশন বা টানেল ভিশনের মতো কিছুটা দেখতে পাচ্ছি, ভালোই দেখতে পাচ্ছি। কেন? ম্যাকুলাটা বেঁচে গেছে, ম্যাকুলা হ্যাজ বিন স্পেয়ার্ড মানে বেঁচে গেছে। ওয়াই? বিকজ দিস ম্যাকুলার এরিয়া হ্যাজ গট এ ডাবল সাপ্লাই, মিডিল সেরিব্রাল আর্টারি, posterior cerebral artery. Macula has got a macular area or extreme posterior pole of the occipital lobe where the macula is represented. It's supplied by the double artery, posterior cerebral artery and middle cerebral artery. So if one artery is blocked, other artery can supply brain and survive the cells of the macular area, and it is called the macular sparing. পারবে অ্যান্সার করতে পারে? তাহলে এটা গেল ম্যাকুলার স্পেয়ারিং, পাল্টে দাও, এটা ছেড়ে দাও। এই যে মিডল সেরিব্রাল আর্টারি, ও আরেকটা কথা, middle cerebral artery usually occupies in the lateral sulcus. What are the structures? এটা জিজ্ঞেস করতে পারে ওরালে। occupies lie in the lateral sulcus of the brain. Lateral sulcus. Number 1, lesser posterior border of the lesser wing of sphenoid. Number 2, superficial and deep middle cerebral vein and the posterior cerebral artery. Middle cerebral artery. এই যে এই সাপ্লাই করছে মিডল সেরিব্রাল আর্টারি টু সাপ্লাই দ্য সুপিরিয়র ল্যাটারাল সার্ফেস করছে পারে। এই যে মিডল সেরিব্রাল আর্টারি ছেড়ে দিন, This is the territory supplied by the anterior cerebral, middle cerebral and posterior cerebral artery. পাল্টে দিন, ছেড়ে দিন ভার্টিবল। ওইটা একটু ব্যাক করুন। This is the arterial circle with dissection. বুঝতে পারছো? This is the interpedunculaar fossa, posterior cerebral artery, posterior communicating artery, internal carotid artery, anterior cerebral artery, and middle cerebral artery going to enter the lateral sulcus. পাল্টে দিন, পাল্টে দিন, সময় নেই। ও তো আসলটাই হয়নি, না না আসলটা এখন হবে। আচ্ছা এইটা দিয়ে দিন 10-15 মিনিট। এরপর একটু ইন্টারনাল ক্যাপসুল পড়া হয়ে গেছে তো। ইন্টারনাল ক্যাপসুল, হ্যাঁ, ইন্টারনাল ক্যাপসুল ইজ হোয়াইট ম্যাটার। হোয়াইট ম্যাটার কি কি টাইপস রয়েছে কুইকলি বলছি। কমিশনাল ফাইবার্স, অ্যাসোসিয়েশন ফাইবার্স অ্যান্ড প্রজেকশন ফাইবার্স। জানো কোনটা কি? ক্লাস দিয়েছিলাম। কমিশনাল ফাইবার্স, projection fibers, association fibers. Skill. First হচ্ছে white fiber মানে কি? Fibers, action on dendrons, excluding the cell body. There are 3 types of fibers are present in the brain: association fibers, commissural fibers and projection fibers. Association fibers ki? The fibers মানে action fibers, white fibers of the brain connect one part of cerebral hemisphere to the other part of the same cerebral hemisphere. রাইট সাইডেরটা রাইট সাইডের হেমিস্ফিয়ারকে কানেক্ট করছে। যেরকম এটা হচ্ছে ফ্রন্টাল, এটা হচ্ছে অক্সিপিটাল লোব। এইখানের একটা ফাইবার কানেক্ট করছে অক্সিপিটাল লোব অফ দ্য সেম হেমিস্ফিয়ার। রাইট সাইডের ফ্রন্টাল লোবের থেকে, যেমন ফ্রন্টাল, ভুলে গেলাম, ফ্রন্টাল লোবের প্রিফ্রন্টাল জাইরাসের সাম ফাইবার্স কানেক্ট করছে অক্সিপিটাল লোবের পার্ট কানেক্ট করছে, তখন তাকে বলা হচ্ছে অ্যাসোসিয়েশন ফাইবার। অ্যাসোসিয়েশন ফাইবার্স মে বি লং, সুপারফিশিয়াল লঞ্জিটিউডিনাল ফেসিকুলাস, ইনফিরিয়ার লঞ্জিটিউডিনাল ফেসিকুলাস, এই কানেক্ট করছে টেম্পোরাল লোব টু অক্সিপিটাল লোব। শর্ট প্রিসেন্টার, which we call the association fibers. Next is the commissural fibers. Commissural fibers are those, there are 2 cerebral hemisphere, right and left, same side of one cerebral hemisphere to the same side of other cerebral hemisphere. মানে এর সিঙ্গুলার থেকে এর সিঙ্গুলার থেকে ওর মিডিয়াল ফ্রন্টাল জাইরাস কানেক্ট করছে, এর অক্সিপিটাল লোব থেকে, এই রকমকে বলা হয় কমিসুরাল ফাইবার্স। বেস্ট এক্সাম্পল ইজ দ্য কর্পাস ক্যালোজাম। এছাড়াও রয়েছে অ্যান্টেরিয়র কমিসিওর, পস্টিরিয়র কমিসিওর। অ্যান্টেরিয়র কমিসিওর এইখানটায় রয়েছে, তারপরে রয়েছে হেভিনুলার কমিসিওর, এগুলি রয়েছে। লাস্ট বাট নট দ্য লিস্ট, মোস্ট ইম্পর্টেন্ট হচ্ছে প্রজেকশন ফাইবার, হুইচ কানেক্টস কর্টিক্যাল সেন্টার অর সেরিব্রাম টু cerebrum spinal cord, both way, from spinal cord to cerebrum or cerebrum to spinal cord. These are called the projection fibers. Best example is the corona radiata internal capsule and fornix. তাহলে এগুলিকে বলা হয় projection fibers. So আমাদের এই যে ব্রেন রয়েছে, এখানে মোটর এরিয়া কেমন, মোটর এরিয়া থেকে পিরামিডাল ট্র্যাক থেকে ফাইবার স্টার্ট করলো অ্যান্ড ইট ডিসেন্ডস, এরকম হিউজ ফাইবার এরকম স্টার্ট করছে, তাকে বলা হয় করোনার এরিয়াটা। একদম সুপারফিশিয়াল সারফেস অফ ব্রেন থেকে নেমে আসছে, দেন উই কল ইট করোনার এরিয়াটা। গ্র্যাজুয়ালি দে বিকাম কম্প্যাক্টেড, compacted কি বললাম, become compact, very much compact, and lie between the thalamus and basal ganglia, and we call internal capsule. Thalamus and basal ganglia এর মধ্যে দিয়ে যখন যাচ্ছে তাকে বল, then it passes through the crus cerebri, then the spinothalamic tract, corticospinal tract, তাহলে এইখান থেকে আমাদের মোটর এরিয়া থেকে স্টার্ট হলো, ইট পাসে এই হিউজ ব্রেনের সব জায়গা থেকে মোটর এরিয়া, সেন্সরি এরিয়া, ফ্রন্টাল লোব থেকে হলো, এইটাকে বলছি আমরা করোনা রেডিয়াটা। কি বলছি? করোনা রেডিয়াটা, সমস্ত জায়গা থেকে ঠিক এরকম, এবং ব্রেন কাট সেকশন করলে এরকমই দেখা যায় করোনা রেডিয়াটা, and they get usually very much thick and ribbon like when it passes between the thalamus, basal ganglia and caudate nucleus. We call it internal capsule. Then the fibers of the internal capsule passes through the crus cerebri of the midbrain. Then is the corticospinal tract, lateral and anterior corticospinal tract, passing to the medulla, then to the pyramid, as a pyramidal tract, cross the opposite side, goes to the spinal cord. So internal capsule a part of projection fibers. Internal capsule এর boundary হচ্ছে, it is bounded medially by the, বেশি সময় নেই, head of the caudate nucleus. Caudate nucleus is look like that. এইটাকে বলে হেড, এইটা বডি, আর এইটাকে বলে টেল, আর এইটা আরেকটা স্ট্রাকচার অ্যামিগডালয়েড বডি বলে। ইট ইজ দ্য হেড অফ দ্য কডেড নিউক্লিয়াস, ইট ইজ দ্য বডি, ইট ইজ দ্য টেল অফ দ্য কডেড নিউক্লিয়াস, কমার মতো দেখতে। দিস ইজ দ্য কডেড অফ দ্য নিউক্লিয়াস। আর এই হেডের মিডিয়ালি ল্যাটারালি রয়েছে ইন্টারনাল ক্যাপসুল, ইন্টারনাল ক্যাপসুলের ফাইবারগুলি নামছে। সুতরাং anteriorly and medially it is bounded by the head of the caudate nucleus, posteriorly and medially it is bounded by the thalamus, and laterally it is bounded by the basal ganglia. So what are the boundary? Medially, anteriorly bounded by the head of the caudate nucleus, and posteriorly it is bounded by the red color thalamus, and laterally it is bounded by the it is bounded by the basal ganglia. Very important internal capsule. এটা বাদ দিয়ে পরীক্ষায় যাবে না। Parts. It has got a, so it is a shape V-shaped. Parts. It has got a anterior limb, posterior limb, and a genu. সুতরাং this is the anterior limb, this is the posterior limb, and this is the genu. This is the genu. There are two other parts. Some parts lie below the posterior limb, below dot, তাকে বলি আমরা sublentiform part, and some part lie posterior to the posterior limb, তাকে বলি retrolentiform part. So it has got an anterior limb, genu, posterior limb, sublentiform part, and retrolentiform part. আচ্ছা, এরপরে যেটা শিখতে হবে কি কি ফাইবার যায়। মোস্ট ইম্পর্টেন্ট ফাইবার যাচ্ছে অ্যান্টেরিয়র লিম্ব দিয়ে যাচ্ছে কর্টিকোপন্টাইন ফাইবারস। এই যে পিরামিডাল থেকে যে ফাইবারসগুলি গেছে তাদের মেইন দুটো ডেস্টিনেশন কি, একটা স্পাইনাল কর্ডে স্টিমুলেট করতে হবে মাসেলের অ্যান্টেরিয়র হর্ন সেলকে, আরেকটা হচ্ছে ইউ হ্যাভ টু ইনফর্ম দ্য সেরিবেলাম। সেরিবেলামকে রেডি হতে হবে যে এই অ্যাকশনটা হবে, তোমাকে এবার অ্যাকশন করতে হবে, কন্ট্রোল করতে হবে, স্মুথ মুভমেন্ট হতে হবে। সো সেম টাইম cerebellum must be informed, but cerebellum will not be informed directly. It must go through some other nuclei known as the pontine nuclei. So all pyramidal fibers coming from the frontal lobe, coming from the parietal lobe, coming from the occipital lobe, coming from the temporal lobe, they gives corticopontine fibers. They go relay in the pontine nucleus present in the pons, we call the pontine nucleus. From that, second order neuron goes to the cerebellum. Eta gelo ekta dik, so cerebellum will be informed. And the main fibers passing through this into the crus cerebri and inform the spinal nucleus on the cranial nuclei of the head neck. তাকে আমরা বলি যাদের হেড নেককে দেয় কর্টিকোনিউক্লিয়ার ফাইবার্স, আর স্পাইনাল কর্ডে যেটা যায় কর্টিকোস্পাইনাল ফাইবার্স। So corticonuclear fibers supply the facial muscles, supply the tongue muscles, etc. And corticospinal fibers supply this muscle, biceps, triceps, etc. কেমন? আর কে যে ফাইবার যায়, আমাদের রেটিনা থেকে ফাইবার যায়, ভিজুয়াল ফাইবার্স। ইয়ার থেকে ফাইবার যায়, তাকে বলা হয় অডিটরি ফাইবার্স, অডিটরি রেডিয়েশন। তাহলে অ্যান্টেরিয়র লিম্ব দিয়ে কে যাচ্ছে? সমস্ত পন্টাইন ফাইবার্স গুলি, কর্টিকোপন্টাইন ফাইবার্স। আর যাচ্ছে কি? থ্যালামাসের কিছু ফাইবার্স যায় টু রিচ দ্য থ্যালামাস, তাকে বলি আমরা অ্যান্টেরিয়র থ্যালামিক রেডিয়েশন। তাহলে এই মাঝখানে রয়েছে অ্যান্টেরিয়র থ্যালামিক রেডিয়েশন, আর দুপাশে রয়েছে কর্টিকোপন্টাইন ফাইবার, ফ্রন্টোপন্টাইন, টেম্পোরোপন্টাইন রয়েছে। জেরু দিয়ে যাচ্ছে, এইবারে আসল জায়গায় চলে গেলাম, corticonuclear and corticonuclear and corticospinal fibers of the head neck. এই ফাইবারস গুলি ওখান দিয়ে যাচ্ছে। ওয়াই ইম্পর্টেন্ট আমি বলছি। আর কে যাচ্ছে? কিছু কর্টিকোপন্টাইন ফাইবার যাচ্ছে। আর পস্টেরিয়র লিম্ব দিয়ে যাচ্ছে মেইন আমাদের ট্রাঙ্কের কর্টিকোস্পাইনাল ফাইবারস। সাবলেন্টিফর্ম দিয়ে যাচ্ছে অডিটরি রেডিয়েশন, কানে যেটা শুনছি সেই ফাইবারস গুলি। আর রেট্রোলেন্টিফর্ম দিয়ে যাচ্ছে তোমার ভিজুয়াল এরিয়া ফ্রম দ্য মিডিয়াল অ্যান্ড ল্যাটারাল জেনিকুলেট বডিজ। তাহলে এটা আমরা কি শিখলাম? যে যদি জেনু ড্যামেজ হয় তাহলে আমাদের আপার লিম্বের এই প্যারালিসিস হয়ে যাবে, আর যদি পস্টেরিয়র লিম্ব ড্যামেজ হয় তাহলে আমাদের হেমিপ্লেজিয়া হয়ে যেতে পারে। হেমিপ্লেজিয়া হয়ে যেতে পারে, কি হবে? হেমিপ্লেজিয়া হবে। হোয়াট ইজ হেমিপ্লেজিয়া? প্যারালিসিস। তাহলে আজকে এই থাক।
Brain, a human brain. Now, you see the undersurface of the brain with the optic chiasma, olfactory lobe, superior colliculus, inferior colliculus. The parts of the brain already you know. What are the lobes? Bolo, what lobe? Bol. একসাথে নয়, একজন বল। occipital lobe, ঠিক আছে। Now you also know it is covered by meninges দিয়েছিলাম। You see, don't এগুলো ছাড়াবে না, meningesটা দেখো। It's covered by just a tracing paper, tracing paper এর মতো একটা কভারে আছে। তার মানে ডিউরাম ম্যাটার, অ্যারাগনম ম্যাটার, পায়া, ঠিক আছে। এগুলোই জিজ্ঞাসা করা হবে। and what are the locations of the all the nerves where they are from the brain stem and the brain. There are ascending tracts, descending tracts of the spinal cord, and depending the area, like you have the brain is supplied, arterial supply is end arteries. That's why a patient comes with you, ডাক্তারবাবু আমার কিরকম যেন মাঝে মধ্যে আমার মাথাটা ঘুরে যাচ্ছে আর তার সঙ্গে আমি যেন কিছু দেখতে পাচ্ছি না। তো তো সেই সব সিমটমস নিয়ে যখন আসবে পেশেন্ট, you will have to look into it as, and it is transient TIA, transient ischemic attack, মানে একটা মাইনিউট ভেসেল ওখানে ব্লকেজ হোক, রাপচার হোক, যে কোনো কন্ডিশনে, that leads to no blood supply in that area for a transient period, and if at all it recovers, then it recovers. Are massive, you see the paralysis, the blood supplying the corpus callosum, and it will depend on which side, right side of the brain or the left side of the brain. Then the opposite side is like এরকম হয়ে গেল. Now that means the muscles of this side is active. এরকম হয়ে গেল, এরকম হয়ে গেল, এরকম হয়ে গেল, হাতটা এরকম করে. Now these conditions are কোন areas, but minutely this figure I would say, for your own interest, hemicule, the brain is you see it's a section of the brain, ধরো এই sagittal section, sagittal section. তো whatever the area, একটা অদ্ভুত ছবি আঁকা আছে, আমি নেক্সট দিন দেখিয়ে দেবো. তো নেক্সট রিভিশন যখন ক্লাসটা হবে, গ্রেজ ডাউনলোড, গ্রেজ 36th edition of Grace. You will see, now you see the sulci gyri, and if you see the sagittal section, the ventricles of the brain. Now this is the corpus callosum, this is the membrane separating, এটা sagittal section হচ্ছে, ওটা হাফ হয়ে গেছে. Now don't take it out, because that's the ventricle. You see this is with the membrane, and this is the membrane is taken off. Now you see the difference. That's the lateral ventricles of the brain. Naturally, through the CSF, through the fourth ventricle, then it goes to the spinal cord. This is the journey of this CSF through the total nervous system in the brain, where brain is concerned and spinal cord is concerned. And it's a beautiful sagittal section. One by one, 5 of you have your tab or atlas. It might be Netter or it might be Times, anything. You compare and study.
So the heart rate will increase and action of sympathetic nervous system. Together the pupils are dilating. Okay. Give any example. Go outside the lecture hall and see a tiger. Now what happens? Immediate reaction is turn around and run. So another question whether that will save me or not, but I'll turn around and run. So heart rate will increase, everything occurring. So many systems, they in the 2nd century when the term was coined, they thought everything, so many systems, so many things are being affected simultaneously, and they called it a connection between the different systems, different these reactions. একই সাথে simultaneously the pupils are dilating. Okay. In the eye, the heart rate is increasing. So many things are happening in the body. So that is, they are calling that a connection between the body parts. Somehow, like this, the term was coined, sympathetic division. The parasympathetic division, that there is a separate thing called parasympathetic division, we came to know, that means the human beings, these came to know only in the 20th century. Then it was called, as one term has been coined sympathetic, that term was coined parasympathetic. Okay. So already one term coined, so the other term became parasympathetic. That is how the terms are coined. But sympathetic division, actually sympathetic division and parasympathetic division, now we know that they are occurring in concurrence. So through a particular organ, sympathetic nerves are also there, parasympathetic nerves are also there. Whichever whenever is required, they are occurring. Whichever whenever is required, they are occurring as required for the body. So when voiding is required, voiding, it is an example. That means whenever there will be micturition, urination. Whenever voiding is required, parasympathetic division will come into action. When bladder is getting filled, but there is no chance of voiding, there is, okay, bladder is getting filled and voiding will be done later. Now sympathetic division will help to keep the bladder filled, okay, along with the sphincters, external sphincters. So they will work according to the needs of the body. So the basic structural difference with the somatic nervous system is it is a two neuron system. Now see, between the parasympathetic and the sympathetic division, what is the basic difference in the structure? What is one which can be seen clearly? See, where is the ganglion located? So usually in the parasympathetic system, the ganglion which we are speaking of, between the CNS, two neuron system. The preganglionic neuron is long and the ganglion is situated, the ganglion which is giving rise to the postganglionic neuron is very near the effector organ, usually it is very near the effector organ. In the sympathetic system, it is usually somewhere in the, not in the exactly in the middle, but it is far away from the effector organ. So that is the difference between the sympathetic and the parasympathetic. So in the somatic nervous system, there is no question of this ganglion or in between. Whatever the neuron, the nerves will come from the within the central nervous system. Mainly for muscles, we speak of lower motor neurons from the spinal cord level. Upper motor neurons from the cerebral cortex to the spinal cord. These tracts, corticospinal motor system already discussed, corticospinal tracts and all. So that is, and from the spinal cord to the effector organ, lower motor neuron. So this is actually the lower motor neuron. Single neuron going to the effector organ. And at neuromuscular junctions, you know what is the neurotransmitter? Acetylcholine. See written acetylcholine. So in the autonomic nervous system also, in most cases, in all the, here there are two neurons. The preganglionic neurons will synapse with the postganglionic neuron. Okay. There is the ganglion, within the ganglion, the preganglionic neuron will synapse with the postganglionic neuron. There also the neurotransmitter is acetylcholine. See here, same neurotransmitter, acetylcholine. Here also acetylcholine. Between the preganglionic and the postganglionic neuron, the neurotransmitter is acetylcholine. So first the structural difference, and then what is the neurotransmitter? In the somatic nervous system, it is acetylcholine. Okay, do you get it, all of you? Somatic nervous system neurotransmitter is acetylcholine. In the autonomic nervous system, in most cases it is acetylcholine. Like all preganglionic neurons will release acetylcholine at the neuromuscular junction, not neuromuscular junction, sorry, at the synapse. Synapse is the junction between two nerves, and neuromuscular junction between nerve and muscle. Neuromuscular junction in the somatic nervous system is acetylcholine. In the preganglionic neurons of both sympathetic and parasympathetic, that means autonomic nervous system, whether it is a parasympathetic neuron or the sympathetic neuron, the neurotransmitter is acetylcholine in case of the preganglionic neuron. Don't talk. If you have to talk, then leave. Do anything by yourself, but don't talk. Don't make any sound. And see, this thing, adrenal medulla. Okay. Why is it given as a separate picture? Because adrenal medulla, from this picture, you remember, from this picture, adrenal medulla is considered a specialized ganglion. In case of the adrenal, what is the difference with these three pictures? Now here, one neuron is coming from the CNS to the adrenal medulla, and there is nothing such as the postganglionic neuron. This is the difference. What is adrenal medulla releasing? Epinephrine, norepinephrine, these things, they are going directly into the bloodstream like hormones. So adrenal medulla we consider with the endocrine system, but it is like a specialized ganglion. Why? Why you are speaking? Norepinephrine is released from adrenal medulla because in case of sympathetic nervous system, the effector organs, the sympathetic actions need the neurotransmitter which is norepinephrine. Difference with the parasympathetic nervous system. Where is the norepinephrine the neurotransmitter? Not in the somatic nervous system, it is acetylcholine. Not in the parasympathetic nervous system, it is again acetylcholine. Whether preganglionic or postganglionic, it is acetylcholine. In case of the sympathetic nervous system, for the actions at the effector organ will need norepinephrine. And in case of the adrenal medulla, there is no question of any postganglionic neuron. So it is a modified ganglion. Type of explain why type of question in the exam. Adrenal medulla is a modified ganglion. So you have to explain from this, not from your knowledge of endocrine system. You will try to think from the endocrine system, you will not get the answer. So here is the answer why the adrenal medulla is a modified ganglion. There is no question of postganglionic neuron here. Preganglionic neuron, which should not be called preganglionic here because there is no ganglion. Adrenal medulla is a part of an organ itself. It has been modified, but like it is releasing epinephrine, norepinephrine, these things, and they are going into the bloodstream. And as you know, they are hormones. Those are going via the bloodstream to the effector organ. Okay, these basic structures. Don't take pictures. These are from standard textbooks. They have copyrights, and copyright does not mean right to copy. In India, copyright means right to copy. So making Xerox of books and these pages, all these are illegal. So don't take pictures. I'll land in trouble. These basic pictures are there in all textbooks. All textbooks you are following, these basic things, everything is written. So again, just revise what is the basic difference structurally. One neuron system in somatic nervous system, two neuron system is autonomic nervous system. In most cases, acetylcholine is the neurotransmitter. In the parasympathetic system, in preganglionic as well as postganglionic neurotransmitter is acetylcholine. In sympathetic system, in preganglionic neurons, it is acetylcholine. In postganglionic neuron, it is noradrenaline. In case of adrenal medulla, there is no postganglionic neuron. Adrenal medulla, noradrenaline, and also some other substances, adrenaline, dopamine, etc., released into the bloodstream. One explain why type of question from the exam point of view. Adrenal medulla is called a modified ganglion. Now this is the era of MCQs. One or two MCQs, one or two information which will help in MCQs. In case of sympathetic nervous system, one exception where even in the postganglionic neuron, again the neurotransmitter is acetylcholine, is the sweat glands. Sweating occurs under the action of sympathetic nervous system, and there the neurotransmitter instead of norepinephrine is acetylcholine. So as it is an era of MCQs, in sweat glands, postganglionic neuron, what is the neurotransmitter? There will be four options. It will be acetylcholine, not norepinephrine. Generally it is norepinephrine, but that is an exception. In sweat glands and in some viscera, in some muscles. In some cases, some muscles, some organs, there are exceptions, but one prominent exception is the sweat glands, where sweat glands, there it is acetylcholine. From this discussion, we should, before proceeding further, we should again explain two terms, adrenergic and cholinergic. We just understood sympathetic and parasympathetic. Now usually the term adrenergic is used with sympathetic. Adrenergic means related to adrenaline and noradrenaline. Adrenergic. So where there is the effector organ, norepinephrine is the neurotransmitter, there we use the term adrenergic. Cholinergic, wherever there will be acetylcholine, we use the term cholinergic. Now when In case of sweat glands, what will be that exception? What will be the term? It is sympathetic as well as cholinergic, because in sweat glands, instead of norepinephrine, the neurotransmitter is acetylcholine. So wherever there is acetylcholine, the term is cholinergic. Wherever there is epinephrine, norepinephrine, term is adrenergic. In most cases, sympathetic and adrenergic receptors, we'll discuss about receptors, everything, those are coming under the classification adrenergic, because norepinephrine is the neurotransmitter in most cases. But in case of sweat glands, the system is sympathetic nervous system, but it is coming under the classification of cholinergic, okay, because the neurotransmitter is acetylcholine. Okay, so in this era of MCQs are set in so many ways. Choose the right option, choose the wrong option, choose which is not true, choose which is anything. Writing choose which is not true and choose which is false is same thing, but just creating confusion. Choose which is not true. So all except. So all these are adrenergic except. So you have to choose from the option sweat glands. Okay, next slide. Now basic organization of the sympathetic and parasympathetic nervous system. So all these viscera and all, anything involuntary is under the control of autonomic nervous system. Earlier it was called vegetative nervous system. Wrong term, of course. Vegetative means not that in the dead body autonomic nervous system is working. That means we are not being able to control it voluntarily. So many things, the picture looks complex, but actually it is not so complex. So we just understood what is the basic structure from the CNS, from any part in the CNS. It may be the CNS, means it will be the brain or the spinal cord. What will arise in case of autonomic nervous system? The preganglionic neuron, and then it will reach a ganglion, and then from the ganglion, postganglionic neuron will go to the effector organ. So effector organ in case of autonomic nervous system are the viscera and the glands. Say take any organ, see the heart, see the lungs. So in the left side this is sympathetic nervous system, in the right side is parasympathetic nervous system. They are showing sympathetic nervous system on the left, parasympathetic on the right. The diagram is looking complex in the beginning, but it is not so complex if you understand. So see the heart. So just for example, for starting with, see the heart. Nerves are reaching from the sympathetic nervous system, also from the parasympathetic nervous system. Now how do they label this? Foreign diagram like that. See this first. Bit simpler than that. We'll go into that, but bit simpler than this. See again, on the left side sympathetic, on the right side they are showing parasympathetic, just for the sake of understanding like this. So both will be on both sides. Sympathetic nervous system, parasympathetic, both will be on both sides. If you have read about the sympathetic chain in the anatomy class, already discussed. So this is the sympathetic. If you already know, this is the sympathetic chain. That will be on the both sides in the diagram. For the purpose, just for the simplicity, they are showing on one side, but actually this is on both sides. Now sympathetic nervous system, see the neurons, preganglionic neurons are arising from the spinal cord. See, now focus on the this side. From this level, only see the sympathetic chain, already also labeled here, sympathetic chain. Can you see, all of you? See, these are the ganglia. Okay. Now, as they are located near the vertebral column, they are called the paravertebral ganglia. Okay, paravertebral ganglia. And see, 3 or 4 are labeled: celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. These are prevertebral ganglia. Those are prevertebral, and those along the much more in number, along this vertebral column, along the spinal cord vertebral column, these are paravertebral ganglia. These prevertebral or paravertebral ganglia, which are the ganglia we are speaking of, ganglion in the middle. So from where nerves will arise from this levels of the spinal cord. Thoracic T1, T2, T3, T4 up to T12 is the thoracic part of the spinal cord, and L1, L2, L3 upper lumbar. So thoracic and lumbar part of the spinal cord, nerves are arising in case of the sympathetic nervous system, and preganglionic neurons, nerves are reaching the ganglion in the paravertebral column, which forms the sympathetic chain. When they are connected, all these ganglia are connected by nerves, axons, neural axons obviously, so they together form the sympathetic chain, this part. And the preganglionic neurons are arising from the thoracic and upper lumbar parts of the spinal cord, not from the cervical and sacral parts. Not from the cervical and sacral parts of the spinal cord. Okay. So sympathetic division is also called the thoracolumbar division. This also comes as an explanation. Sympathetic division is also called the thoracolumbar division. See, neurons are arising from the thoracic, whole of the thoracic part of the spinal cord and the lumbar segments. We should not call it parts, segments. Neural segments, thoracic neural segments, 12 in number, 31 spinal segments, 31 pairs of spinal nerve. So thoracic and upper lumbar. So sympathetic division is also called the thoracolumbar division. Okay, for this reason. And just with that, see, for the parasympathetic division, it is arising from, this is above the spinal cord, brain stem. This part is brain stem. Okay, this part is brain stem, and see the sacral region of the spinal cord. Parasympathetic neurons, preganglionic neurons, are not arising from the thoracic or the lumbar parts, arising from the brain stem and the sacral segments of the spinal cord, few sacral segments of the spinal cord. It is called the craniosacral division. Sympathetic is thoracolumbar, parasympathetic is craniosacral. Cranium is the brain box, as parasympathetic is arising from the brain stem, not the spinal cord, brain stem and the sacral segments of the spinal cord. So it is called the craniosacral division. Some are from cranium, that means the brain stem, cranium within the brain box, so the term cranio, and from the sacral segments of the spinal cord, so it is craniosacral. So sympathetic is thoracolumbar, parasympathetic is craniosacral. Now see, in the earlier diagram, at first it was becoming a bit confusing. See, most of the organs which are working involuntarily are innervated by both sympathetic division and parasympathetic division, which we were speaking of earlier. That earlier they thought only there is sympathetic division and the heartbeat is going fast, breathing is increasing only in case of emergency situations, fight or flight reactions. They did not know about the parasympathetic system. We did not know about the parasympathetic system. Now later, only about 100 years ago, the parasympathetic, that there exists a separate division, we came to know of that, and it was termed, all these, most of the these organs, heart, lungs, all the GI tract organs, the bladder, the male and the female sexual organs are all under the control of both divisions, sympathetic as well as parasympathetic. And usually they have antagonistic functions, but they occur according to the needs of the body. Like heart rate will decrease if it is under the, when it is under the parasympathetic control. Under the sympathetic control, heart rate will increase. So before that, see, that is just an example. Before that, preganglionic neurons are reaching the paravertebral ganglion in most cases, say from T1 at the same level, and it may also reach at other levels. See, there is no sympathetic ganglion in the sympathetic nerve root, or preganglionic neuron is the cervical part, there is nothing such, but cervical ganglia are there. Okay, so their nerves are reaching from the thoracic level only. Okay, cervical ganglion are there, superior cervical ganglion, middle cervical ganglion. You may have heard the names in anatomy. Okay, there are the cervical ganglion, their nerves are reaching from the thoracic level. In the cervical level, there is no preganglion neuron. Nerves may reach the same level or the other level, and nerves may also cross over. Some neurons, preganglion neurons, are crossing over through the paravertebral ganglion to the prevertebral ganglion. Prevertebral ganglia are named according to, see the names, go back to knowledge of anatomy, abdomen. These are all large celiac trunk, superior mesenteric artery, large arteries, okay, celiac trunk, they are named according to those. So these ganglion are named according to those. Those are near the celiac trunk, those are near the superior mesenteric artery, inferior mesenteric artery. The ganglia are named, prevertebral ganglion are named according to that. And some neurons, preganglion neurons, are crossing the paravertebral ganglion and reaching those prevertebral ganglion. So up to the prevertebral ganglion, whatever there is, that is the, in those cases, that is the preganglionic neuron. And from the preganglion, then will start the postganglionic neurons. Whatever is in red on the left hand side of the picture, whatever is in red, these red lines are preganglionic neurons. The blue dotted lines are postganglionic neurons reaching the respective organs. So, see, from the celiac ganglion to the stomach, liver, pancreas, spleen. Now see, in case of the adrenal medulla, what is it happening? Through the this paravertebral ganglion, preganglionic neuron is reaching the adrenal medulla, and here there will be no postganglionic neuron. The substances will be released into the bloodstream. So no blue dotted lines in case of adrenal medulla, because blue dotted lines are depicting the postganglionic neurons. Okay, postganglionic nerves from the cervical ganglion to all these organs. So what are they? We will discuss to all these organs. Pupillary dilator is the dilated muscles of the pupil, submandibular gland, submaximal gland, parotid gland. From those starting from the T1 to T5 levels, preganglion neurons up to the ganglia. All ganglia are not named. Okay, so then reaching the heart and lungs. From the next levels T6 to T10, T11 to the celiac ganglion, to the superior mesenteric ganglion, inferior mesenteric ganglion, and sometimes they are overlapping. Some nerves may come down from the upper levels and reach the lower levels also. Okay, lower levels here, but the origin will be from either the thoracic segments or the lumbar segments. In case of sympathetic system, thoracolumbar division. This is the basic thing which you have to remember. You don't have to learn which segment T1 is supplying, T1 to T5 is for heart and lungs. You don't have to remember this thing. But basic, that thoracolumbar division, sympathetic will arise from thoracic part and lumbar part, and parasympathetic will arise from the brainstem and the sacral part. Thoracolumbar, craniosacral. Okay, next slide. So here see, they have named a few more things. So in the previous diagram it was somewhat simpler. Cervical ganglion, superior. Now here say superior cervical ganglion, middle cervical ganglion, stellate ganglion. They have named these. Stellate ganglion is fusion of two other ganglia. Okay, inferior cervical ganglion and so all these will now supply the organs. Now here see, they have labeled the splanchnic nerves also. Splanchnic is related to abdominal. So the greater splanchnic nerves are from the, this is the sympathetic chain. Here this is the sympathetic chain. That means the paravertebral ganglion, and these are the prevertebral ganglion, celiac ganglion, superior mesenteric, inferior mesenteric. This is superior mesenteric, this is inferior mesenteric. So through the splanchnic nerves, they are reaching, these preganglion neurons are reaching the ganglion, and from there the postganglion neuron will supply the organs, even the reproductive organs. In case of the parasympathetic nervous system, for the those arising from the brain stem, the autonomic neurons run along with the neurons for the 4 cranial nerves. Now you know about cranial nerves from physiology practical classes. So 4 cranial nerves. Which 4 cranial nerves here? 3, 7, 9 and 10. So while discussing the nerves, we used to say, we have already told, facial nerves is for supplying which glands? Which salivary glands? Submandibular and sublingual. Glossopharyngeal is for the parotid gland. Now just think of the first diagram. The ganglion was situated near the effector organ. See, from this diagram it is confirmed. The ganglia which we are speaking of are situated near the effector organ. Sometimes inside also. In case of the eye, pupillary constrictor muscle. The preganglion neuron is long and postganglion neuron is very short. Third nerve nucleus name is Edinger-Westphal nucleus. The neurons are going up to the ganglia, supplying the postganglion neurons are supplying the pupillary constrictor and ciliary muscle, helping in accommodation. Accommodation is held by pupillary constrictor for constricting the pupil, ciliary muscle for increasing the curvature of the lens. So parasympathetic, under the action of parasympathetic system. Pupillary dilator is under the action of sympathetic system. Okay, so pupillary constrictor and ciliary muscle reaching through the ganglion name is ciliary ganglion. Ganglion name is ciliary ganglion. Facial nerve, we already know, supplying which glands? Salivary glands are submandibular and sublingual. Lacrimal is not a salivary gland. Salivary glands are sublingual and submandibular, and lacrimal glands are for production of tears. See, the lacrimal glands and also the nasal glands. What is the name of the ganglion? Sphenopalatine ganglion. Okay, these few you have to remember because this is the era of MCQs. Earlier in the details, when we are in MBBS, we skip some, teacher skips something. But this is the era of MCQs. If question comes in a professional course, you cannot say this was not in the syllabus. So this is the era of MCQs. Few ganglia you have to remember the name, especially in these regions. The ganglia which are related to this 3rd, 7th, 9th and 10th cranial nerve. See, Edinger-Westphal nucleus for the oculomotor nerve. Oculomotor nucleus name is Edinger-Westphal nucleus. Preganglionic neuron is going to the ciliary ganglion. From there, postganglionic neuron is going to the effector organs, will be pupillary constrictor muscle and ciliary muscle, helping in accommodation. From the 7th nerve, separate preganglionic neurons, one to the sphenopalatine ganglion, postganglionic neurons to the lacrimal and nasal gland. Another neuron is to the submandibular ganglion for the submandibular and sublingual salivary glands. And parotid gland, we know from the knowledge of practical physiology, parotid gland is supplied by which nerve? Glossopharyngeal. The ganglion is otic ganglion. Preganglionic neurons coming from the nucleus of the 9th nerve. What is the, also there is the name of the nucleus also given. See, Edinger-Westphal nucleus for the 3rd nerve, superior salivatory nucleus for the 7th nerve, inferior salivatory nucleus for the 9th nerve. So nucleus, both this may appear, a big complex at first. See, for the 7th nerve, nucleus is single, superior salivatory nucleus, but preganglionic neurons are going to 2 ganglia, sphenopalatine and submandibular. Sphenopalatine is for lacrimal and nasal glands. Submandibular ganglion is for submandibular and sublingual glands. And inferior salivatory nucleus, so don't make the mistake that superior and inferior salivatory nucleus are not both for the 7th nerve. For the 7th nerve, nucleus is single. For supplying the glands, for the secretions, nucleus is single. See, which nucleus? Superior salivatory nucleus. But ganglia are 2, sphenopalatine and submandibular. Sphenopalatine for the lacrimal and nasal glands, submandibular are for the salivary glands, supplied by that nerve, facial nerve. In case of the cranial nerve number 10, which is the vagus nerve, usually speak of two nuclei, dorsal motor nucleus and nucleus ambiguous. And the postganglion neurons, preganglion neurons are going to these ganglia. All ganglia are not named. Okay, these ganglion situated again. What is the structural similarity? Situated near the target organs. Target organs are heart, lung, stomach, all these, GI tract, small intestine, colon. The ganglia are situated near the target organs, right? Autonomic nervous system is not very detailed, is not very required from exam point of view, is only in physiology. But when in pharmacology you have to read the drugs, you have to have this concept. Without having the concept, if you just go on remembering and memorizing the drugs, you can remember nothing. And it is from the exam point of view in pharmacology also, a lot of questions will be asked in the exam and for basic understanding. All those drugs, adrenergic system, cholinergic system, you have to read separately and know the names of the drugs. Okay, so this basic concept is very necessary. Now, if someone asks, say this is take the example of the small intestine. In this case, in the postganglion neuron, what will be the neurotransmitter from whatever we have discussed? Say small intestine. This is the ganglion, postganglion neuron reaching the small intestine and will induce secretions. So, what is the neurotransmitter? Acetylcholine, obviously, acetylcholine. From the celiac ganglion, these blue dotted lines, postganglion neurons, say reaching take a better example, say reaching the bladder. What will be the neurotransmitter? Blue dotted lines, norepinephrine. What is the only exception? Not only, but most common exception we talk of, where the nervous system is sympathetic, but the neurotransmitter in the postganglion neuron is acetylcholine, sweat glands. See, I have the given sweat glands here. See here. So they have instead of blue dotted lines, they have used red dotted lines. Same thing, postganglion neuron in the sympathetic nervous system, but they have used red dotted lines because they are the neurotransmitter. There is nothing blue, red, green inside the body. These are just for diagrammatic understanding purposes. All neuronal structures are similar. Here the neurotransmitter is acetylcholine, although it is the sympathetic nervous system. Sweat glands, sweat under the sweating is under the control of sympathetic nervous system. But the neurotransmitter is acetylcholine. এখানে কি দেখা যাচ্ছে না, এটা গার্ড হয়ে যাচ্ছে, দেখা যাচ্ছে যেখানে সোয়েট গ্ল্যান্ডস লেভেল করা আছে। সি দেয়ার দিস রেড ডটেড লাইন দেখা যাচ্ছে, উপরে তোলা যাবে, দেখা যাচ্ছে না, সরাতে হবে। See now, see sweat glands আরেকটা ডায়াগ্রামে দেখতে পাবেন একদম নিচে, here they are showing red dotted lines from the ganglion, postganglion neurons to the sweat glands by red dotted line, যেটা প্যারাসিম্প্যাথেটিকে দেওয়া আছে mainly because parasympathetic are always cholinergic, be it preganglion neuron, postganglion neuron, it is cholinergic. In sympathetic it is adrenergic mostly, but in case of sweat glands it is cholinergic because acetylcholine is the neurotransmitter. আগেরটা এসো, so see here they have shown it in a looking complex, but the same thing, see different organs are there. Eye, pupillary dilator muscle, dilatation of the pupil under the control of sympathetic nerve, constriction under the control of parasympathetic. Name of the muscle is sphincter pupillae. Likewise, dilator pupillae, control of sympathetic nervous system. Okay, so here they are showing this line. This is the postganglion neuron to the from the ciliary ganglion postganglion neuron, that is the parasympathetic, coming to the eye. Here from the sympathetic system, from the superior cervical ganglion coming to the eye. Now it is almost very difficult, at least for beginners, to remember from which ganglion to which organ separately. Everything is not required, but at least few important things you know, like we call the third, fourth, seventh and 10th nerve. What are the name of the nuclei? Again, just name the nuclei. Oculomotor nerve nucleus name is, because these will appear in MCQs and will confuse you. Edinger-Westphal nucleus for the third nerve. Then for the seventh nerve, superior salivatory nucleus. For the ninth nerve, inferior salivatory nucleus. And for the 10th nerve, dorsal motor nucleus of vagus and nucleus ambiguous. Okay, some things you have to memorize, nothing to do. First, try to do it in the class itself. Very short time left for the exam. These are the name of the nuclei. Name of the, now names of the ganglia. For the third nerve, supplying the preganglion neurons are going to the ciliary ganglion. For the seventh nerve, going to two ganglia, sphenopalatine and submandibular. For the ninth nerve, to the otic ganglion. And for the 12th nerve, to unnamed ganglia, and then unnamed ganglia for the heart, lungs and GI organs. Right? 4 নম্বরটা যাও। Now you see, now again it is difficult to remember all actions, but few you already know in whatever you have read in physiology till now. Few you already know, like sphincter muscles of iris, that is the sphincter pupil, constricting the pupil under the action of parasympathetic nervous system. Ciliary muscle contraction for near vision, you know, accommodation, contraction. Now see what difference you have to remember. Usually what comes to our mind is, when contraction of the ciliary muscle will help in accommodation for near vision, obviously relaxation will help in accommodation for far vision. Accommodation we usually speak with respect to near vision. From far we are looking towards near, and the test is, clinical test is also done in that way only. You look far, then look, you keep the finger in front of the nose, you look near. That is how we test for accommodation. So usually we discuss accommodation in terms of looking from far vision to near vision. But obviously in the real world, sometimes we are reading a book, suddenly we have to look far away. There is a sound, loud sound, and we look far away. So relaxation of the ciliary muscle. But most standard authors are saying that for relaxation of the ciliary muscle, sympathetic nervous system is not required. On most organs, actions of sympathetic and parasympathetic are antagonistic. That means they are opposite to each other, but not necessarily. Some authors are writing ciliary muscle relaxation is under the control of sympathetic, but most standard authors are not writing. Relaxation of ciliary muscle, they are just relaxing, but for that sympathetic nervous system is not required. Just instead of for contraction, parasympathetic is required, but for relaxation, sympathetic nervous system is not working actually through some receptor. Now receptor types are given here. Receptor names are, you will read more in pharmacology about this, names of receptors. In case of adrenergic, the neurotransmitter is norepinephrine. There are two broad types of receptors are classified. Two broad types are classified, alpha and beta. And alpha is again subclassified as alpha 1, alpha 2. Beta is subclassified as beta 1, beta 2, beta 3. For parasympathetic system, there are muscarinic and nicotinic receptors labeled as M and N. Now here you see contraction for near vision by ciliary muscle by parasympathetic. Mostly postganglionic neurons, there are the muscarinic receptors. Okay, muscarinic receptors in the parasympathetic system. In case of sympathetic system, receptors may be alpha or beta. Okay, so we'll continue this discussion in the next class. Autonomic nervous system will require another class. So today I think you should have understood the basic structure, the structural organization, ganglion in the middle in case of autonomic nervous system, and one neuron system in somatic nervous system, and basic structure, names of few ganglia, and the basic structure that ganglia are located somewhat far away from the effector organ in case of sympathetic nervous system, and very near the effector organ in case of parasympathetic nervous system. Okay, next class on this.
Nowadays in modern medicine, modern treatment plan, etc. So before we go to the next slide, can anyone give me any example of use of radioactivity in medicine with your so far knowledge? Huh? Chemotherapy, very good. Anything else? Chemotherapy, আমি very good বললাম না, ঠিক নয়। very good বললাম because তুই বললি, বাকিগুলো বোবা। ঠিক হোক গুলো তুই বলেছিস, তাই তো? কেমোথেরাপিতে রেডিও কথা নেই, এটা হয় না। রেডিওথেরাপি বললে ভালো হতো, তাই না? আর গ্ল্যান্ডের অ্যাক্টিভিটি, নাম কি? থাইরয়েড স্ক্যান, বোন স্ক্যান, আর এমআরআই নয়, সিটি স্ক্যান টু সাম এক্সটেন্ট, এক্স-রে, আর খুব রিসেন্ট এখন ব্যবহার করা হয় কারোর ক্যান্সার হয়েছে গিয়ে ডিটেক্ট করার জন্য পেট স্ক্যান, তাই না? তাহলে পেট স্ক্যানের পুরো নাম কি, ফুল ফর্ম? টোমোগ্রাফি। গুড। তো পেট স্ক্যান হচ্ছে লেটেস্ট মডেল। এই তিনটে যে জিনিস সম্বন্ধে কার কার আইডিয়া আছে? Spontaneous decay of the nucleus give rise to production of alpha particle, gamma rays, and beta particle. Right? You all are aware of this transformation of radioactive elements. What is the starting product? C. And what is the end product? Lead. Right? So whatever radioactive element we start with, ultimately it will produce lead. Right? That's why plenty of lead was found in some ready-to-cook noodles company product, because radioactivity is a potent way to kill pests. So they use radioactive substances to kill pests during the transport of the wheat or flour, which remain as a remnant in the food. Are we aware of this? Curie, millicurie, and becquerel. 1 curie is equal to 3.7 10^10. This is a very large unit. What are the smaller units? Millicurie, microcurie. These are much more smaller units. So when we measure radioactivity for human body, we measure in millicurie or microcurie, not in curie. If we provide radioactivity in curie level, then we probably will die. Anyway, now these are international units and US unit for radioactivity is called Rontgen units. Just know the names, that's all. Another is how much radiation is absorbed. How do you know? By this unit, gray and red. Gray and red. When Fukushima disaster happened in Japan, the engineers and the reporters who visited the place for reporting purposes after coming from Fukushima, they used to be kept in a center, separated center, rehab center, where their rad is to be measured. Right? Now this is the concept of half-life, the decay of any radioactive element to half-life. Now this is the comparative penetration power of three particles. One of them is not particle, it's only ray. This is gamma ray. Which one penetrates furthest? Gamma ray. Why? Because there is no mass. Which one least? Alpha, because it is heaviest. So which one is more detrimental? Gamma rays. So what happens when gamma rays penetrate our cells, tissue, skin? It touches the cell. Inside the cell it touches the DNA. In DNA it causes some damage called mutation. You like this mutation to happen with you? Is there anyone who wish to become like this? Anyone? Why? No one. First, you want to become like this. The day we discover how to make calculated mutation, we will become God. We can do many things, but we cannot calculate the randomness of the mutation. Right? It is just a mere luck by chance, someone became like this. But this many times we have seen in newspapers, in medical journals, and those who have parents as gynecologists, they might have reported at home, today we delivered such kind of baby. With multiple limbs, multiple head, preformed, unformed, underformed limbs. So the effects can be divided in three ways, three types. One is immediate effect, which occurs with immediate exposure to the radiation, depending on the power, the extent of radiation. Next is delayed, it will occur after some time. And last is genetic defect, which will remain even after the source is withdrawn forever. It will remain inside our cell forever. Means a genetic defect will take place. Means it will change the character of chromosomes, which we will inherit from our parents. So any mutation in parents will be again trickle down to our own genes. So which one is most dangerous? This one? Is there anyone who has suffered from like this in the world? Any known incident? Yes. Hiroshima and Nagasaki. Even today, there are many babies are born with multiple limbs because that gene has completely been altered. So their offspring are always malformed. Immediate effect was they all died, they all got charred, burned. Delayed effect, they died due to internal damage of the tissue. And genetic effect, still they are suffering from the effects of radiation. What are the immediate effects? Skin lesion, ulceration, bone marrow depression. The first thing will be counted as low. Bone marrow depression means low hemoglobin. Low hemoglobin. Cerebral vasculitis, meningitis, squamous fasciitis, all sorts of inflammatory conditions. Nausea, vomiting, acute diarrhea due to damage of gastrointestinal mucosa, means the cells which perpetuate more rapidly will be damaged earliest. Hair follicles, the mucosal lining cells, the GI tract, all these cells will be affected at the earliest. delayed. Some damage will occur, will show up after some time. Say during pregnancy, one person was exposed to radiation. At the end of the pregnancy period, when the baby was born, he was born with certain abnormal syndrome, polydactyly, correct? Or malformed heart. All these birth defects, high rate of neonatal death and congenital deformity. So the people who work under radiation, say for example, nowadays there is a provision that you can go for soft X-ray, which will harm less, digital X-ray. But previously there was very strong X-ray used to be used. So the technicians and the doctors who used to go do all these tests, they used to suffer a lot. They suffer a lot. The young doctors, very often, they used to complain with birth defects with their babies. Nowadays, it has been reduced. So these are all occupational hazard. See this one. So whatever you do, if you pursue your study with nuclear medicine before marriage, beware. After marriage, okay, now you don't want any babies, you can go. No problem. Whatever harm will happen to you. The genetic defect. The far long-sighted effect will be genetic defect. DNA will be there till we die, even our all generations. Application in medicine in two ways: diagnosis and therapy. Diagnosis, X-ray, the well-known radiation, the oldest one. Then detection of foreign objects in the inside body. What do we use for X-ray? Like this. See, these two pictures are for two palms. So both are looking same. When we take X-ray, then we see extra phalanges. So like these bones can be visible. These can be visible. That object should be radio opaque to visualize anything hidden in the tissue. Right? Scanning of organ and what is this? Radioimmunoassay. Nowadays it is obsolete, not used anymore. But scanning of organ is used. See? They are doing X-ray. They are doing scan. What is this given? A radioactive iodine dose has been given to the patient. Now it is known that iodine content is highest in the active thyroid gland. So then after consuming that pill, the thyroid gland is scanned with a gamma camera which will catch the gamma radiation. Why gamma radiation? Because alpha and beta will not be able to penetrate from gland to outside. Only gamma will come. To some extent, beta can come, but it is very, very rarely used. So the instrument which is used for detection of gamma radiation is called gamma camera. The instrument which is used for detection of beta radiation is called scintillation counter. It's called scintillation counter. Mostly we use gamma camera. We take a photograph of this. How does it look like? See, like this. This is your job. This is your job. Here there is radiation, and here you are sitting. The patient will pass it through urine within a day. But in a day, you are in this position with 20 patients, 30 patients, because money matters. Right? What will happen? The small damage in each time you are exposed to the patient will cause harm to you. These are 4 conditions. The images of thyroid scan. This is the hyperactivity of the thyroid gland called Graves' disease. This is normal. This is toxic. and this is myxedema, and this is toxic adenoma. There are 4 conditions has been given, like this. Right? So hyperactivity can be seen in toxic goiter, Graves disease, and toxic adenoma. Toxic goiter, Graves disease, and toxic adenoma. It will look like this. It is a color option. This yellow color means hot spot. Blue color means cold spot. How many hot spots you have in a gland will detect the severity of the disease. If you have thyroid cancer, the whole area will be yellow. The other way of bone scanning. Bone scanning is done to understand the bone density throughout the body and any bone deformity. It is done not with calcium but a separate, an artificially made radioactive element called technetium 99M. M stands for mass. Technetium 99M. So this element is injected in a patient and it goes to several conditions. If it is injected to the bone scanning will give the result. Bone scanning will give the result. The density, see, the higher the density, that means bone is active. The lower density means bone is inactive, means bone is going through osteoporosis. It is not able to produce new bone cells. So bone is becoming weaker, feeble and fragile. So whether the bone is active or not, how do you know it is producing new bone cells or not? By this scanning. The same compound is used for even scanning for cardiac muscle viability. Same compound is used for cardiac muscle viability. Radioimmunoassay is a technique used for assay or estimation of very low amount of hormones. Till the discovery of ELISA, RIA was the only way to find out or measure TSH, T3, T4 or any other hormone. Right? But it was slowly, it is omitted from the system because it is harmful for the environment and for the users too. When it is thrown in the sink, it goes into environment, it goes into river, it goes into sea, ocean. So it pollutes every part of the planet. This is the way it is done. It is mostly comparable with which ELISA? Direct ELISA. Right? এটা পড়ানো হয়েছে আমার কোনো দরকার নেই। This one you can note down. This may be asked as a short question. Okay. What are those? For GI tag C141, gallium, G for gallium, B for phosphorus, I for iodine. Iodine has two forms, 125 and 131. See the half-life, 60 days and 8 days. 125 is used for and 131 is used for. What is the difference? When we are going for diagnosis purpose, we are giving iodine 131 because it has less half-life. So it will be readily washed away from the body. But when you are giving for treatment of cancer, we do it with the injection so that it will stay for a long period and do the work inside the body. So we choose a radioactive element which has higher half-life. For any diagnosis purpose, low half-life, treatment purpose, high half-life. SR and see, the lowest is technetium magnesium, 6 hours. Strontium 85 for bone lesions and brain scans. These were used before. Nowadays it is used only technetium. For all, heart scanning, bone scanning, everything, brain scanning, all technetium is done. Okay? This is widely done. So just remember the product, what it is used for. Now come to radiotherapy. Radiotherapy is called teletherapy. What is the difference? Telephone, telescope, television means vision from distance. Right? So when we are using the source of radioactive element at a distance, it's called teletherapy. When you are using it within the body, it's called brachytherapy. Which one will give more activity and more efficiency? No, it depends on the organ. Can we reach lungs? No. Can we reach cervix? Yes. Can we reach larynx? Yes. Can we reach liver? No. To the organs which are deeply rooted, deeply placed, for them we prefer teletherapy. For regions which are on surface or easy to approach through any nozzles. Yeah? For suppose there's a tumor at the base of the brain. Yeah? We can reach through nose. Right? So for the organs which can be reached easily, for them it is called brachytherapy. Yeah? For uterine cancer, cervical way can be utilized for brachytherapy. How does it look like? Usually, the small radioactive elements, needles are imported. In India, it comes from bark, BARC. So the bark, they send it in a large lead box. This much lead box. Inside there will be small amount of radioactive element, which will be divided in few needles, 2 to 3 needles per pouch. Say for cancer in the larynx, 2 to 3 needles per pouch, needles of this size, are placed inside the throat here through a thread, and the patient is asked to swallow the pouch slowly, and the thread will go, the pouch will go and reach here in the larynx, and then they will tie it with a teeth, one of the tooth, like this. You keep it for some time and then take it out. That's all. We cannot keep it for prolonged period, otherwise the surrounding tissue will get damaged. cervix, prostate cancer, for this purpose it can be used. Like this. There is a tumor here. How do you approach this? Transurethral way, we can place the needles inside. Can we approach the urinary bladder? How? Why? Catheter. So placing a simple catheter through which we can place the needles inside the urinary bladder. Inside the urinary bladder means it will come near to the prostate gland. So there we can reach the proximity to the prostate gland. How to reach uterus? See, like this. For cervical cancer, like this applicator is placed inside through vagina. Rectal way can also be approached for prostate. Now, teletherapy, like this, an instrument is there, and sometimes the patient is kept like this. Sometimes, after doing the oncosurgery, the whole portion is kept open, and then the ray is given. Suppose there is a massive spread in peritoneum of cancer. Then after surgery, the patient's wound is kept open and directly ray is given in the open wound to rule out even the small amount of cancer cells. This is one of the ways of giving ray, and this is another way of giving ray. That's teletherapy. So brachytherapy and teletherapy. This is not end, this is just beginning, because positron emission tomography is a hot cake now, is used nowadays. So PET scan can be asked as a short note. Radioactive units can be asked as a short note. Different types of radioactive damage can be asked. Different types of radioactive elements used in medicine can be asked. At least you have to mention few. What are those? Iodine 125, iodine 131, strontium, gallium and technetium 99M. Okay. That's all for today's class. Small topic.